Benzodiazepines. Benzodiazepines, colloquially known as benzos, are a class of depressant drugs whose core chemical structure is the fusion of a benzene ring and a diazepine ring. They are prescribed to treat conditions such as anxiety disorders, insomnia, and seizures. Benzodiazepines are depressants that enhance the effect of the neurotransmitter gamma-aminobutyric acid GABA at the GABAA receptor, resulting in sedative, hypnotic, sleep-inducing, anxiolytic, anti-anxiety, anticonvulsant, and muscle-relaxant properties. Benzodiazepines, for example, clonazepam, lorazepam, bind and modulate GABA-A receptors on central nervous system neurons, resulting in an increased frequency of chloride channel opening in the presence of GABA. This increase in chloride permeability hyperpolarizes and stabilizes the membrane, rendering it less excitable, resulting in the anxiolytic, muscle-relaxant, and anticonvulsant properties of benzodiazepines. Due to risk for dependence, benzodiazepines are generally prescribed for short-term use in anxiety disorders and alcohol withdrawal syndrome. Benzodiazepines are categorized as short, intermediate, or long-acting. Short and intermediate-acting benzodiazepines are preferred for the treatment of insomnia. Longer-acting benzodiazepines are recommended for the treatment of anxiety. Examples of benzodiazepines include Diazepam, lorazepam, Triazolam, temazepam, Oxazepam, midazolam, chlordiazepoxide, alprazolam. Most benzodiazepines have long half-lives and active metabolites. Exceptions include alprazolam, Triazolam, Oxazepam, and midazolam. They are short-acting benzodiazepines with higher addictive potential. In an overdose, benzodiazepines can cause respiratory depression and coma, but they are less toxic than their predecessors, the barbiturates. Death rarely results when a benzodiazepine is the only drug taken. Adverse effects of benzodiazepines include dependence and additive central nervous system depression effects with alcohol and barbiturates. They all bind with the GABA-A receptor. Treat benzodiazepines overdose with flumazenol competitive antagonist at GABA benzodiazepine receptor. Flumazenol can precipitate seizures by causing acute benzodiazepine withdrawal. Barbiturates, for example, phenobarbital, increase the duration of opening of the GABA-A receptor chloride channel in the presence of GABA. Although barbiturates have anxiolytic properties, they are not indicated for the treatment of anxiety disorders because of their potential to induce fatal respiratory depression. Inhibition of serotonin reuptake is the mechanism of action of selective serotonin reuptake inhibitors, for example, fluoxetine. Inhibition of serotonin and norepinephrine reuptake is the mechanism of tricyclic antidepressants, for example, amitriptyline and serotonin norepinephrine reuptake inhibitors, for example, venlafaxine. These antidepressants are frequently used to treat panic disorder, but they take several weeks for symptom improvement. Unlike benzodiazepines, they do not have muscle-relaxant or anticonvulsant properties. Benzodiazepines bind GABA-A receptors, resulting in an increased frequency of chloride channel opening in the presence of GABA. Indications for prescribing include short-term treatment of anxiety disorders and alcohol withdrawal syndrome.